Good morning, and your health news time right now is 8:23. A new study shows more millennials are choosing to freeze their eggs to take the pressure off of having kids off their plate. That's according to the Society for Assisted Reproductive Technology. Here to talk more about that is Dr. Tiffany Jones from Conceive Fertility Center. Good morning to you, Dr. Jones.
Good morning. Good morning.
I know you're a busy lady, so thank you so much for waking up early and joining us here on Daybreak. So let's start off with, I guess, who should consider freezing their eggs?
Any person who wants to have children or maybe is undecided about having children should consider freezing their eggs. A person who even identifies as a male and is undergoing transgender assignment surgery should consider freezing their eggs because they don't know what, or maybe they don't know what they want to do genetically with their children in the future. Also, people who are diagnosed with cancer, especially cancers of the ovary or breast, should consider freezing their eggs with that diagnosis.
Before going through any kind of treatment.
Exactly.
Yeah, you know, one of my girlfriends, she's I think 32 or 33, and she said, you know what, Cleo, you know, I'm not in a relationship. I want to have kids, but definitely not right now. And she made that decision. And I told her, you know, that's an awesome move to make.
Yeah, it's really important just to consider it. If you don't do it and you have fertility issues, especially later in life, then most of the time the options are using someone else's eggs. So borrowing from yourself from a earlier time in your life would probably be helpful.
Now, how long can the eggs be frozen?
Probably forever.
Wow.
Yes. There are people who have used eggs that were frozen longer than they've been alive and made embryos or embryos from someone else and then carried those children. So eggs can probably be frozen for forever.
I think this is where things get a little challenging when we talk about, I guess, the cost of egg freezing.
Yeah, it can range. It can be as cheap as $5,000 to $6,000 or expensive as 15 to 20, depending on the clinics.
You know, I think right now, I guess with this new age and how things are changing for different generations, a lot of jobs, places of employment are offering to cover those costs.
Absolutely. Carrot, Progeny are fertility-based insurance packages that some employers have, like Google and Meta. So you definitely should talk to your HR department and see if it's covered. And even sometimes you can help your HR find those type of insurers.
Exactly. Dr. Jones, how long does the process take from, I guess, start to beginning?
Yeah, the actual, when you're doing something, is about 2 weeks. So it's actually really quick.
It's not that long.
No.
That's not that long. And I know the process can be a bit daunting, right? And I believe that different fertility clinics can really help you through this process, even explaining, I guess, the steps it takes and helping you through it. What do you guys do at Conceive Fertility Center?
So you meet with a fertility specialist in the beginning to go over the process. And yes, it is very daunting. So during that process, you have medical assistants, nurse practitioners, physician assistants that can help also bolster that first initial visit and help walk you through. We're available at night, so I get nighttime calls with patients that are, you know, a little bit nervous about what they're doing, but we really try to be accessible and available.
Dr. Jones, before we go here, how can people contact you and reach out to you?
Yeah, so you can go to our website, www.conceivefertilitycenter.com. I'm at tjonesivfmd on Instagram, so you can contact me there.
Dr. Jones, thank you so much for joining us this morning, and thank you for really, I guess, doing your work here in the community and helping so many people.
Well, thank you for having me.
Of course, of course.